joining us today. As Catherine said, my name is Stephanie Colon, and I've been a member of Women United for probably 3 years. Women United is a vibrant, diverse community of women leaders within the United Way Central Florida Leadership Giving Association, and we transform our community through volunteerism and philanthropy. Our members are deeply committed to mobilizing the carrying power of women as we work to create a legacy of change. Thank you for being a part of this dynamic group of women leaders in our community. To learn more about how you can engage with your work, please visit uwcf.org. And today I'm excited to welcome United Way of Central Florida's COO Rod Crowley and a panel of experts representing all United Way impact areas. Rod will share a quick overview of his first 8 months on the job during the crisis, the current crisis. So our panelists include Rod Crowley, like I said, Stacy Walsh, the Chief Development Officer of the Ymca of West Central Florida, Rusty Music, Executive Director of the Church Service Center, Carrie Falwell, Chief Executive Officer for Explorations 5 Children's Museum, Alice Kaler, President and CEO of Lakeland Volunteers in Medicine, and Terrell Davis, Director of the Mulberry Community Service Center. And if anybody has any questions throughout today's call, we'll allow at the end, but you can put them in the chat room. Is that right, Catherine?
Yes.
Excellent. So Rod, take us away.
I think he's on mute.
Oh, there you go. You're on mute. Not yet.
Test.
Yes.
We good now?
We hear you.
Okay, good deal. It was weird. I actually hit the unmute button that time and it didn't work. So thank you, everybody. We really appreciate the opportunity to present kind of the impact world and some of the challenges that our agencies have faced and some of the things they've had to overcome in the last 8 months since COVID hit. As at least some of you know, I did a few weeks of training with Penny Borgia prior to her last day heading into retirement on March 13th, and that was Friday the 13th. The last time that everything kind of changed overnight that weekend. We went from leaving work on Friday and people weren't supposed to get together in groups of 200. The next day it was 50. And by Monday, we weren't supposed to get together in a group of 10. So since then, you know, it's kind of been a continual hurricane type of a mode to a degree. We've adapted on quite a few different fronts with United Way of Central Florida. I've joked with some people that it's kind of been interesting because a lot of those first 3 weeks of training with Penny, a lot of our major initiatives that we've done since then were not even foreseen as part of this job before that. So some of those things are, first of all, our 17 food sites that we have throughout the county. Of which some of the guests on here today with me are helping to direct some of those. We went overnight from a normal shopping type experience at those sites to a drive-through process because of safety due to COVID. Also, along with that, the donations to Feeding Tampa Bay, which is our supplier for those sites, cut in half, and in some cases 75% was lost pretty much in that first week or two because all of those items were flying off the shelves at the grocery store and weren't available to be donated. One of the things we put together to respond to that decrease in donations was through a donation from the George Jenkins Foundation. We at United Way, we're able to partner with Sunland Distribution over in Lake Wales, and they provide us some free freezer space in their warehouse. They provide us a truck and a driver for 2 months, And with the donation from George Jenkins Foundation, we put together a mini distribution system to where we purchased 350,000, purchased and had donated 350,000 pounds of frozen goods, mainly proteins, meats, cheeses, things like that, that we supplemented our 17 sites and a couple sites in Highlands County throughout that couple months of April and May into June. We had some great partners with Performance Food Group, which sold us semi-loads of frozen chicken for 10 cents a pound. Tampa Bay Fisheries donated over $200,000 worth of frozen, all kinds of different frozen seafood products. We had a lot of other partners that kind of came together and donated blueberries and cucumbers and lettuce as part of the Farmers to Family Food Box program. On top of that initiative, which was a large project in itself, we had the United Community Relief Fund in cooperation with GiveWell Community Foundation, which helped to, I think we had 34 different agencies we assisted to help our community members on the first round, and 33 agencies on the second round. That was a total of $610,000 that was gotten out into the community to help citizens. The largest thing we've ever undertaken with United Way of Central Florida was Polk County Unites. We have now distributed $15 million. $10 million of that went to individual assistance, and $5 million of that went to nonprofit COVID relief assistance. So it's been some of the biggest undertakings ever. On top of that, we were just entering into the meat of the CIT, which is the Community Investment Team allocation process, which evaluates all of our partners and makes the decisions on where the dollars are going to go to. We had to pivot that into a virtual process. We had a lot of discussion at first. Do we continue it? Do we just go by last year's percentages? I was really proud that our volunteers and our staff were able to convert the program into a virtual platform to be able to continue that and still go through that entire process to the end, because it's a phenomenal strength of our agency. Some of the things that I'm most impressed with is just the network throughout our communities, the overwhelming support and the relationships that we've been able to build through this. It's just been amazing to me. And I know I've had a lot of discussions with the internal staff, how whenever we were faced with a challenge, it seemed like a lot of the answers just came to us. Either somebody would make a call to us or we would get an email, hey, do you know anybody who needs this? It's just phenomenal, all of the things that I didn't even mention that happened, that we just kept pinching ourselves, just saying, wow, it's amazing how these things are kind of almost falling out of the sky. But because of the relationships, the community support we have, dozens of extremely solid partners and things like that as well. My wife, Jeanette, who's on the call, I've been here about 15 years and I've built up a pretty good bank of community partnerships through involvement. Thank goodness my previous boss at Southern Wine and Spirits had a strong belief in being involved in the community through the chamber and through LEDC and supporting community activities. We're involved in the leadership forum at Southeastern every year. And I had a pretty good bank, but I've noticed throughout this process that every time I don't know somebody or don't have their contact information, I just ask Jeanette, and I think she's about 100% on being able to help me make those connections and things. So that's been helpful as well. So I can't thank all of the 5 guests that I have on here to speak today enough for everything they've been involved in, because they're involved in multiple efforts of ours, and they're going to share with you all some of the things that they've had to overcome and that they see as the most important long and short-term needs that are coming up. Because as we all know, things are changing. We don't know where this virus is going and how bad this next wave is going to be. We've already heard of some of the shutdowns in other states that happened yesterday. So we just don't know what the next little time is going to be. But one of the things that came to mind, I was trying to look up some synonyms for the word overwhelming, because I was thinking, it's been quite an overwhelming year. And you wonder, like, how can you get through some of these times when you have so many things that you're trying to accomplish at once, or so many people you're trying to help. And, we've kind of had just the attitude that we can only do as much as we can do each day. And then you just get up the next day and do as much as you can do that day. But when I was looking up synonyms, I noticed that a lot of them actually have a positive connotation. So I want to just share with you some of the synonyms for overwhelming, which kind of surprised me. Some of them are mind-boggling, amazing, exciting, overcoming, breathtaking, eye-opening, stunning, staggering, astounding. So really, it's all of those things have been positive outcomes of what has happened during COVID within our organization. So I think all of those things are positive terms that maybe describe overwhelming and just some of the positive stuff that's happened out of this crisis. So I'm going to go ahead and turn it over to the first guest. I have Terrell Davis. I'm just going to go alphabetical order to let him talk. But another bit of irony I found is that in 2020 there was only two Friday the 13th in this year. One was March 13th, that day that I officially took over Penny, and the other one was this past Friday the 13th. And I achieved my doctoral degree somehow amidst all of that from Southeastern University on Friday afternoon. I defended. So Friday 13th are interesting in the future. I'll never think they're unlucky again. So anyway, so Terrell, I'll turn it over to you. Thank you.
Thank you, Rod. Well, good afternoon, everyone. First of all, I want to thank you. I want to just send a shout out to the United Way Central Florida team. It's just such a nice opportunity to work with a group of people that, they have their respective roles, but every time we have an initiative or a grant cycle, they become a part of our organization. And I just don't say that because we're on this call, but, we started food pantries last summer, a year ago, and, Christina was there. Penny was there. Catherine was there, just all the resource people were there, and just on and on. And so that's kind of how it's been. It's been very hand-on, and as we've gone through different challenges and had different opportunities, they've been there for us. And I just wanted to send a shout out because that makes it much easier for us out there as community partners, and really just having that support of United Way Central Florida in everything we do. So we really just want to just say thank you guys for everything you do, and thank you for having us here. I'm Terrell Davis with the Mulberry Community Service Center and Personal Finance Center, Polk County. We're an income partner. Basically, we're responsible for the financial education, credit repair, and free tax prep, job credentials, etc. And we're also responsible for the VITA free tax prep. Many of you guys may be familiar with the AARP tax prep program, but we have something called VITA that we do through United Way Central Florida. And we're kind of like the process owners through that. We'll talk a little bit about that when we talk about challenges, but we work with other income partners, and we have some of those on the call, and they'll express some of the challenges that they're seeing as well. But as I look at how we've been able to adapt and kind of service during the crisis, I'm thinking about maybe last February when, of course, we saw parts of the country, like on the West Coast, kind of figuring out what this virus meant. And as we saw it kind of come across from New York down into the Southeast, and then eventually into our communities around April. And we were in the middle of our tax season, because what typically happens is that the folks that get returns, they file early, probably January, February. And the people that will pay money or, is going to break even, they typically file, probably in the March, 1st of April. And what happened was we had, in this case, our location, we had 4 or 5 locations. We had a Mulberry location, we had a Larry Jackson location, Fort Meade Library location, Winter Haven Library location, and Haines City Library location. So you can imagine the scope of residents that impacted, where we had schedules out there, and we had to reach out to these residents and say, hey, unfortunately, the libraries have shut down. We're not going to be able to file your taxes. And if you look at that from a monetary standpoint, the average tax return on just a 1040 is about $250. And so last year as a whole, across all departments, we did approximately 1,400 tax returns, but you can see that created some type of financial impact as well as the inconvenience of what I'm going to do. Now, we all know that the government was nice enough to extend that deadline, but we didn't go back. Those libraries did not open up again in time to accommodate that. And so what we're able to do, many of those people, we had a site years ago called myfreetax.com, and we were able to send some of those people to those sites and they were able to do it themselves. But that was kind of like the beginning of the crisis. Then we got into May, and of course we had to pivot. Rod talks about this a little bit. Our mobile food pantries, we host two. We do one in Mulberry, we do one over in Haines City at a local church partner. We decided to do the drive-through. In other words, we didn't want drivers to get out. We didn't want our volunteers to get out and interact with drivers, a way to try to create some safety and some type of buffer. And so basically asked those participants to open the trunk of their cars, and we would place those food boxes in the back of the cars. And there was a way to, again, create the safety buffer, but yet, in many cases, address a need. Now, we thought that food pantry wasn't something, very glamorous at that time, but as we saw around June, July, the participation began to grow because at this point, with unemployment starting to kick in and some of the, the hassles of people, getting through that process, people were starting to need a food pantry. We saw that the grocery prices started to go up. There are some estimates of maybe 15%, whatever that number may be, but we really started to see where those mobile food pantries really became, something that was a necessity for some people. Okay. And so now we're kind of like, at the third and fourth quarter of the year, typically right now we'd be doing our financial classes. And of course, it's been hard to solicit people to want to be in a small classroom settings. Typically we'll have 10 to 15 people in our classroom settings. What we're able to do back in July was we pivot to more of a Zoom class format, and we continue to do our partnerships around the county, but we did it in a Zoom class format. We had some lunch and learn formats. We had a lunch and learn format set up with Publix, the corporate center. We had one over at the Dundee City Hall that we had to reschedule. But again, we're able to use some of the technology and to continue some of the formats using the technology. We're currently, from a standpoint of what's important for us, the short-term and long-term needs and responsibilities, I think we're all seeing that with COVID, some basic needs are really becoming on the horizon for most people. Whereas typically we had a very strong economy and people were in a habit of giving and giving back. And so now as a nonprofit, we're having to get out there and do more of that grassroots type of fundraising again, getting out in the communities, churches, organizations, and individuals. And I was talking to my teams yesterday. I said, hey, we're just going to have to look at this as something as, okay, the next couple of years is going to be different. I won't be available to them the way I used to be, and I'll be out doing more grassroots type fundraising opportunities, community partnerships and stuff like that. And I think the key is that we have to keep ourselves relevant in our communities and across the county, because I think it's going to be easy for people to say, hey, I can't give right now. I shouldn't give right now. I should be taking care of my own. And so we have to keep ourselves relevant in our respective communities. As far as our greatest challenge right now is going to be participation. And it's interesting because participation with Rod talks about a CIT process, and it's a very, prudent process, lots of due diligence and thought, and goes into that process. It's something that we don't take lightly. Our funding levels are dependent on that. And so we really put a lot of time and effort in our reporting, in our presentations. And so, of course, one of the concerns we have is people wanting to participate in our program. In other words, we typically have a classroom format. Now, we've been able to pivot and utilize some technology, but again, sometimes when it comes to learning, particularly when it comes to financial stuff like credit reporting and stuff like that, people tend to be more interactive from a learning style. Because, I'll sit in a corner and I'll talk about, well, maybe something I learned with credit, and then another person would share a story that they had, and they tend to kind of learn and they kind of feed on each other. So we're trying to recapture that format, if you will, utilizing technology. Over at One More Child, we're doing kind of a hybrid setting over there where we're actually broadcasting, even though we're over with a single mothers group. We're doing our classes, hosting our classes there, but we're broadcasting it via Zoom. So maybe people at other parts of the community can kind of chime in and be a part of those sessions. One of our greatest success stories, we thought, and it was a nice community partnership opportunity, because when we think about the East County, I'm going to say like north of Lake Wales up to like Davenport, there's not a big presence of, I'm going to call United Way partners over there, whether it's income, safety net, health, any of those. And we were able to partner with the town of Dundee. They call themselves the town of Dundee. That's the city of Dundee. A church called Trinity International. And we do our mobile food pantry at Trinity International. We're able to do a makeshift, what we call an intake center, office space at Trinity International. And the town of Dundee gave us their city commission hall to do our intake center for people that were needing help with the COVID release, the Polk Unites grant. And so how it worked out, our agency, we had $500,000, and we helped a total of about 450 people, but 60% of those dollars went to the East County. So it was interesting because, again, from the north of Lake Wales up to about Davenport, there was no presence over there as far as, or nowhere that people could go and get that help. And due to those partnerships with the town of Dundee and Trinity International, we're able to help those residents and help them, through this crisis with $2,000 in support towards mortgage, rent, or utilities. So that's kind of how it's been for us. And again, it's about participation, staying relevant, and making sure that the community and the county knows that we're relevant, and we're out there helping people. And we're getting calls right now for Thanksgiving, dinners and stuff like that. And so we're going to be doing some of that down in Mowbray as well.
Thank you,
Any
Terrell.
questions?
I think we'll take questions at the end, right, Stephanie? Yeah, okay. Carrie Falwell.
Hello, good afternoon, everyone. Thank you for having me. I'm honored to have the ability to speak to all of you today and answer some of the questions that Rod gave us. I am Carrie Falwell. I'm CEO of Explorations 5 Children's Museum. For United Way, we have two programs: an income program called Financial Fitness for Families, and then a literacy intervention program that we run as a summer camp. Both were incredibly impacted by COVID, Rod asked about organizations. I'm going to try to talk in broad scopes here. So we adopted to the crisis the only way we know how, which is to keep the focus of our service on children and families. So our mission is to curate the world for all children to explore. And sometimes that means curating the current reality of the world. So in March, when schools closed and the governor created the stay-at-home order, we also closed, of course. That was on a Friday. By Tuesday, we had a call from the Polk County Department of Children and Families, and they asked us to consider serving as a care facility for elementary age children, specifically for children of essential workers at Lakeland Regional Hospital and the city of Tampa, or city of Lakeland. So we talked to our educators. They knew what the risks were. They knew, their job was going to change pretty drastically because we're not traditionally a child care facility, although we do run fantastic drop-off programs. And they all said, absolutely, we want to serve our community. We want to be here for kids, and we want to do it the right way. So we, within a matter of a week, rewrote our cleaning procedures. in line with consultations with Dr. Haight from Lakeland Regional Hospital, who's their infectious disease expert. And we coordinated with Lakeland Regional Hospital to make sure that their employees knew what our program was. Same with the city of Lakeland. And we were here for them. And then we were lucky enough to be awarded a United Community Relief Fund. And then we were able to subsidize some of those costs from the families of essential workers. It was a lot. But one thing, it's a story worth sharing, is you'll hear not just Explorations 5, but any children's museum say children learn through play. And you hear it all the time, children learn through play. And it seems really ethereal, and you're like, yeah, of course they do. But this is why they learn through play. So we would come in and the kids would have playtime in the exhibits. And there's a really strict schedule of how long they could be in particular areas because everything had to be sanitized for each group of children. So children stayed in pods together in their classes, and they had to play in those same pods, and everything got disinfected between pods playing in an area. So it was a pretty strict schedule. And we would hear, usually the play is someone's a villain and someone's a hero, and they have to work through what the issue is. Yes. So I'm going to rob Publix, and the sheriff is going to come and save me. And then we're going to go to the theater and dance a magic spell, and it's going to make everyone good again. That's a lot of the play that you'll hear them do. The play this summer sounded a lot different. The play this summer, the villain was almost always COVID. So to do a quick reenactment, it would be, I'm evil COVID. And the kids go, ah! And then they run over to Publix and they go, barricade us in Publix, evil COVID is coming. And then the one kid is like, argh. And the kids all band together and they overcome COVID, and then it's a happy ending. At that point, when we heard that play happening, we had to throw the schedule out the window, and our teachers were on their walkie-talkies and they got to work this out. So what was happening is that the kids were using their play to make sense of this very weird world around them. And they do it all the time. It just seems a little less serious to all of us, but they're always doing problem solving and creative thinking and literacy building and language development. They're doing all of that in their play, but we're used to seeing it. This was an area where they were clearly working on addressing anxiety and self-regulation. And if they didn't finish that storyline, they weren't going to be able to move on with their day. They needed to work through that whole story. They needed to see themselves as the hero. And now they've worked through that, they've gained that regulatory tool, and now they can move on with their day. So what happened is we went ahead and pre and post tested all the kiddos who we knew were going to be with us through the summer. And we pre and post test them on language development. So if you don't know, language is it's a key indicator for literacy. If you don't have language, you can't have literacy. So we expected to see flat. And what we actually found is that they all made things. And some of our children, especially the ones who came in language delayed or on the autism spectrum, made incredible gains because we were using the exhibit play as a regulatory function, which gave them more chance to expand their language. So lots of really wonderful successes and wins in all of that. On the income side, what we're seeing now is the families who have really seen the pain of the pandemic and layoffs, and our financial fitness for families classes are completely full. I mean, we couldn't take anymore if we wanted to. So they're finding us and they're participating in the virtual sessions. They're using the tools that we have. And our program is a little different because it's for the whole family. So we're teaching the same financial language to the children so that it's not something new in the home that seems odd or scary. I think our biggest responsibility right now is parent supports to help with behavior redirection and school supports. We want to make sure that we can understand what the long-term impacts of all of these stressors are, both to how kids are learning and how they're redirecting themselves. We don't really know what the delay is going to be for school kids yet. We won't know that until further into the school year, and probably in the summertime we'll start to see it. But we know that there's going to be some kind of learning delay. It's pretty inevitable. And our greatest challenge and our greatest success for me are the same. So we reopened on September 1st to the general public, and in all of this, we created a guideline. You can go and download it from our website. But we're operating under an augmented policy called safety and kindness. So children can't learn or be expressive or creative if their basic needs aren't being met. So if we go back to Maslow and Maslow's hierarchy of needs, we really have to make sure, do they feel safe? Do they feel loved? And can they identify a sense of self? So we're not terribly worried about talking about, planetary science and Newton's law of motion and color blending and letter recognition, because they're not at a place to do that right now. We need to work on the three basics. Do they feel safe? Do they feel loved? And can they create a sense of self? So if we can work on that, then we can start to level out this baseline of developmental growth. We can give them a foundation to stand on so that the pressures and the anxiety doesn't take over and overwhelm, that we're starting to build those regulatory skills that are so incredibly necessary and so beautifully crafted in play.
Thank you, Carrie. Alice Kaler.
I'm coming. Let me figure out how to start my video. Can you guys hear me? Awesome. Thank you for having me. I'm probably these updates are probably gonna sound a little bit repetitive, given that we're all kind of going through the same thing. I'll try to give you some different take on some of this. Lakeland Volunteers in Medicine receives funding from United Way for 3 programs, chronic disease management and the pharmacy program. And we are a George Jenkins End Hunger Food Pantry partner as well. So we set out this year in January to, let me back up. In 2019, our organization we turned 18 years old. We became a grown-up. We kicked out our dad who retired. They hired me to be the CEO. We built a new building, so we got a new house. And we ended last year with a new strategic plan that, in March, then all the brakes got hit on that, and as with everyone. We had set out to really expand what we're doing, to expand our capacity to serve patients, to expand the services that we provide. And then March 17th rolled around, and that kind of had to be paused, and we had to really reevaluate kind of what we can do during this time. So some of the biggest hurdles that we faced in the very, very beginning were our volunteer workforce, which is why we're able to do the work that we do. We have about 300 volunteers that we rely on to be the front-facing aspect of our organization. They run the front desk, they run scheduling, they do medical records. All of our providers, for the most part, are volunteers. And by and large, they are all in the older generation. Most of them are retired. And as you all are well aware, that is the generation that was most impacted in the very beginning. And we're told they are not safe to go out and they should stay home. And so we lost about more than half of our volunteer workforce. And so we had to really, really pull back and say, okay, what can we do? So we had to make our facilities safe with all of the cleaning procedures, and we installed plexi, and we secured enough PPE to last us at least through the end of the year. It's looking like it's going to last us much longer than we had anticipated. So we wanted to make our volunteers feel safe first, the ones that were coming in. And then we had to look at, okay, how are we going to provide the care, the quality of care that we are committed to providing? So we had to make the hard decision to close to new patients and focus only on the patients that we already had in our roster. So we did close to new patients just for a short time. Then we had to focus on how are we going to keep in touch with that volunteer workforce, because when the time comes to open back up fully and start seeing new patients, we need them to come back. And so we had to really think about how are we going to steward those volunteers and keep them engaged with us. And so those are some of the things that we addressed and were challenged by. We implemented a telemedicine platform. We were really, really, really fortunate to be able to do that with our network of volunteers in medicine organizations throughout the country. I say they're our parent organization. We're not beholden to them in any way. We don't report to them. But our parents, Volunteers in Medicine America organization, secured a donation from doxy.me. So they are providing that telemedicine platform free of charge, which is amazing. We implemented curbside pharmacy. So we tried to avoid having people come in the building if they didn't have to. So telemedicine, you can pick up your prescriptions curbside now. Everybody is screened before they walk in the building. There are no guests allowed in the building. All of those things we worked really hard on implementing very quickly. We also started thinking up we started rethinking what does volunteering look like. So we created some volunteer from home opportunities that include kind of patient advocacy, patient navigation. We have a couple of volunteers who are checking in on some of our clients who need extra care. We have some data entry things going on from home, some collation of documents and things like that. Somebody's translating all of our forms and updating all of our forms right now from home. So we've really tried to keep in touch with our volunteers. We've done a lot of volunteer appreciation in a virtual format. So in April, we did a ding dong ditch. Our staff and our volunteer advisory committee ran around and rang doorbells of all of our volunteers and dropped off little goodies and ran away, social distance style. As of now, we are open to new patients again. During that time, we really focused on recruiting additional medical providers to kind of fill in the gap. We are happy to report that we have 5 brand new nurse practitioners who are volunteering, which has allowed us to reopen to new patients as of November 1st. What else? I will say our greatest successes, I kind of wrapped them all up into those comments. Keeping staff morale high, I'm really proud to say that our staff is more committed than ever. We've done a little bit of staff retreat, and we all did a DISC assessment and some communication strategies. We did not have to furlough a single staff member. Everybody is still with us. Our food pantry, I ran some numbers just out of curiosity. March 10th was our very first food pantry, a week before we all shut down. Our very first food pantry, we served 121 households and 178 people. As of our last food pantry on November 10th, we had 251 households with 796 people. And at our peak on May 12th, we had 292 households with 993 people. So that, I think, speaks, as Terrell and some of you other folks who have done the food pantry project, it really speaks to the need out there in the community. As we move forward and we look at next year, financially this year, LVIM has held steady. Our expenses have not exceeded our revenue. We've really managed our budget pretty well. But I am worried about next year. I think all of us are. Have we tapped out all of our donor sources or not? What does fundraising next year look like? So those are all questions we're asking. for us in particular at LVIM, we know that the need for our services is increasing, whereas the resources are decreasing. And so we really are looking at, how do we continue and what does that look like? We've spent a lot of this time during this pandemic when we had to shorten our hours and some of that time because we didn't have volunteers. Didn't mean we stopped working. We really used that time to focus on, to ask some important questions that sometimes in the hurried and harried regular life, we don't have time to look at. So we've started talking about what does our diversity, equity, and inclusion plan look like? Thinking about those things doesn't cost money. It just takes time. And we had an excess of time during this season. We really started looking at what other social determinants of health can we address? What things that impact our patients' health can we address? It doesn't take resources to connect someone to other resources. What systems can we change internally to make sure that we're caring for the whole person that walks through our doors? As of the end of October, we have provided 24,269 patient visits. As compared to last year, that's about 4,000 fewer services. If you consider that for the months of March, April, May, and part of June, we did nothing that wasn't absolutely necessary. We did no dental hygiene. We did no health screenings. We only cared for chronically ill patients who needed ongoing care or people who were sick and needed immediate care. So considering that, we're actually ahead of where we were last year. And I will wrap up and pass on to the next person.
Thank you. Rusty Music.
Can you hear me?
Yes.
I want to first of all thank Dr. Crowley for inviting me to the table here to be able to share a little bit about Church Service Center and Women's Care Center and things that we're doing, how we've adapted and made some crucial changes to our support services for the Bartow community. And Alice stole my script, actually. Everything she said, from loss of volunteers to all those effects, was everything that I was going to say. So, I don't want to sound too redundant on anything, but, we had a huge impact for our volunteer base here at Church Service Center. Our first food drop was around March 12th as well, right before the pandemic had started or, had really went into full swing. And we served about 250 to 300 individuals for that food drop. And we are now peaking anywhere from 850 to 900 people. So we have, our numbers have gone up tremendously through those food drops. And, some of the bigger adaptions that we had to make through that process is, for our first food drop, we wanted our clients to come through the food line and have the ability to pick and choose some of the items and have some of that self-worth of the ability of choosing their foods and their items that they wanted from our food drop. And that was actually instilled to us in our training through Feeding Tampa Bay and our other partners is, let the clients choose, let the people leave with the things they like, give them that sense of self-worth. So that's what we did. We had that. We had a great process through that, had already started, and then COVID hit. And COVID really put a wrench into that process to where we had to start pre-boxing everything and remove our personal, the ability to have a personal relationship with the clients as they come through. And, it put it in a sense of where they were just driving through, we were throwing it in the back of their cars or throwing it in their trunks and sending them on their way. We really didn't get a sense of who the person was, the sense of what's going on in their life, because the idea of the food drop was to provide them with food, but have additional resources at the drop, and have dialogue with the families as they come through the line and find out what's really going on and get to the root cause of situations. And ours was set up to where we had medical support services there, from medical support services to somebody there assisting with insurance and Medicaid access services, even a spiritual uplifting tent where they could stop by and receive prayer and spiritual uplifting through times of struggle and just words of encouragement from people who truly care. And we had to remove all of that because of COVID. And it was really a struggle for me. For those of you that know me, you know I never meet a stranger, and I'll talk to the wall if it talks to me. And, you know, and that was very difficult for me to take a step back and remove that sense of relationship and just throwing food in somebody's car and sending them on their way. Because that's a big struggle. That was a big struggle with us. And we lost probably about 80% of our volunteers. We generally have about anywhere from 70 to 80 volunteers a year. And we lost about 80% of our volunteers. They're primarily elderly, retired, in the surrounding communities. And rightfully so, they needed to stay home and quarantine, protect themselves, and they've done that. Slowly, we're starting to see an increase of volunteers return. We've implemented a lot of safety precautions, a lot of protections, a lot of our opportunities. When we have volunteer opportunities, you know, it's through our outdoor events and things like that, so that there's a lot of fresh air and a lot of space. But, you know, and one of the other struggles is we also have a shelter through the Church Service Center. It's Women's Care Center. And the shelter, we shelter women and children through there, and women through various all walks of life, different coming and going to different situations, jobs, and trying to manage and balance what that looks like. Because, you know, Church Service Center or the shelter, we never closed through the pandemic. We stayed open. Our support services, our offices stayed open. Our thrift store did close, but everything else was still open to the public, to, you know, people who need. We provide crisis support services for the community, and we were just being inundated with requests and with needs. And so the shelter, you know, was the same way. A lot of the ladies that worked at the shelters, they worked, and I hated that we had to term essential and non-essential jobs. To me, that was very degrading, because I feel that everybody's essential and plays a big role in our economy. But a lot of our ladies worked essential jobs that provided food and different things for the communities that, you know, restaurants, and a lot of the restaurants here in Bartow did stay open with limited services, Walmart, Publix, those sorts of things, and making sure that everybody is protected. And when they come back to the shelter, to the mass, you know, living situation, you know, that, you know, what happens if one lady comes down with COVID? How do we separate that from mass situation, you know, the mass living situations of how the shelter is designed, and what is that going to look like? And so we started really having to, you know, dive in and develop all these different services and all these different protocols and ways to manage that situation. And through that process, our full-time house mother had actually, she was out shopping or out doing something, and she slipped and fell, and she broke both of her legs. She broke an ankle on one leg and her leg on the other. So she ended up having to go into long-term nursing facility to rehab, to build up her legs and everything again. And so she was out of the picture. So we lost our house mother through all of COVID. So we had to scramble and find other people to fill that role and switch out. And mind you, during that time, our shelter was at max capacity the whole time during COVID. And still to this day, by the grace of God, we have not experienced one case of COVID through either organization, through any of the services that we provide. And, you know, and that's a true testament to you know, how well and how our staff is managing things, how well we are, you know, taking the precautions necessary and protecting ourselves, and to the testament to the importance of our services. You know, one of the big things that I wanted to talk about today too, that we have really adapted to and overcome, is we had the opportunity from the very beginning to work alongside with Rod and Christina in the United Way through the Polk Unites process. They got a call from the county, and the county says, hey, we want to give you $15 million to disperse to the community. And, you know, through that process, they reached out to me and a couple other organizational leaders and said, hey, you know, what can this look like? What can we do? So we started all working together, drafting RFPs, et cetera, et cetera. And initially, when we had first started the discussion, we were talking about, you know, letting the organizations disperse anywhere from $50,000 to $100,000 per organization to the community, to the people in the community in need. And once we found out the actual figures and the amount of organizations that were going to participate in this process, in this program, there was no way we could spend that amount of money with just giving that little bit amount of money to each organization in the time frame that we needed. So then we started talking, you know, hundreds of thousands of dollars, and even some organizations received millions of dollars to be able to disperse to people in the community for, you know. And so, you know, this money was essentially dropped in our lap, and through, you know, the United Way's great leadership and really taking the bull by the horns and running with it, we were able to, you know, to spend that, you know, the 15 million in a very, very short period of time, which in a matter of months, which usually it takes, you know, years for us to spend that amount of money. And it was just a huge, great process where we were able to just, you know, persevere and overcome and really get the money into the hands of the community members, our neighbors who truly, truly needed it, who were losing their jobs, who were being laid off and furloughed with no expect date of returning. We're still seeing some of those families today that still have yet to return to some of their jobs because of COVID, and we're still helping them through those processes. And, you know, helping people really, you know, some of the long-term things. Rod wanted us to talk about long-term and what does that look like, or where do we see, you know, some of our long-term you know, processes, and it's really helping our families understand how COVID is going to affect us now in the present time, and how it's affected us in the last, you know, 6-7 months, and what it's going to look like a year from now.
Hey, Rusty, I hate to interrupt. I want to make sure Stacy has some time before we have to get off, though. So I want to turn it over to Stacy Walsh. Thank you, Rusty.
Okay, in the interest of time, I'll go quickly. It all began on March 16th, right? Is that the date that lives in infamy? So Stacy Walsh with the YMCA of West Central Florida. And I just want to say thank you to the United Way for being such a huge support of our community during this time. Out there helping with our food distribution. Rod, you and Jeanette came out, and I just want to thank you guys for being a part of that in the beginning of all of this and continuing to be such a huge asset for us. So the YMCA, we received word mid-March, like we all did, that schools were going to be closing, and that businesses were going to be closing temporarily. And so we had to figure out what's the word of the year, pivot. We had to pivot all of our services and figure out what our need what need in the community we could meet. So obviously, you know, the YMCA is the #1 child care provider in the county. And so immediately we were contacted by LPD, we were contacted by first responders, Lakeland Regional Health, Advent Health. All of those employees still needed to go to work. And so I liked what you said about the non-essential and the essential, because that actually came into play when we were trying to decide with our discounted, free, even at times, childcare, how we were going to decide, well, essential versus non-essential. So we started with the first responders and the healthcare providers. And then we pivoted and began offering our services to more families, because we saw a need within a couple of months. These people were beginning to go back to work. The kids were still in school. School was not out yet. So we started doing e-school at the YMCA. So between March and August, we saw over 1,600 children come through our programs that we served during that time. In addition to doing our childcare services, we also were really fortunate. Although we had to close our branches, we were able to repurpose all of those areas to serve the children that we had at our facilities. So we were able to spread them out, keep them in those low ratios. I swear I had Dr. Haight on speed dial and Joy Jackson throughout this process, just making sure that we were following all of the guidelines that we needed to follow. So what we saw was we needed to reduce our rates while also reducing our ratios. And so that was a big struggle for us, and really hit us hard. So we saw that growing need for to be able to provide that childcare. So we were fortunate that we were able to kind of spread those children throughout our facilities before we reopened our facilities for our members. So right in March, when all of this kind of hit, we were in the beginning of our Kindergarten Learn to Swim program. Our Kindergarten Learn to Swim program we've been doing for over 10 years. And it is a free swim lesson program that we do in partnership with Polk County Schools. We give 1,600 children free swim lessons, and they come to the YMCA during the school day. It's a really wonderful program. And when the schools closed, obviously we had to transition that program. So we were actually, by the end of when the kids went back to school, we gave over 2,800 free swim lessons to children that came throughout our programs around the county. We have programs at the Lake Wales YMCA. We actually, and kind of a blessing in disguise, we would have probably never pursued, at least at this point, a partnership in the Fort Meade community, but someone reached out to us and they needed childcare services provided. These people were going back to work over the summer. And so we got a little task force together and we created the first ever YMCA summer camp program. We partnered with a local church. It was really an amazing program for their community. So that was something really positive that came out of this. I think we've all had to be innovative and creative in our fundraising, innovative and creative in our programming, and our reopening, the ways that we've reopened. I would say probably one of our biggest challenges that we've had is getting our members back, feeling safe coming back to the YMCA. We still have a mask mandate at the Y. We're keeping everything clean. We're really in touch with Lakeland Regional Health. As you know, Elaine Thompson is coming in as our new CEO in January. So we've been working really closely with her and Joy Jackson also. So really, it's just been engaging our more vulnerable populations, our older members, doing wellness checks with them, food distribution, drop off for them, just those phone calls and keeping in touch with them and keeping them engaged and seeing what their needs are. And I will echo Alice's sentiment in that there is a greater need for services. So that's increasing while the means are decreasing. And so I think heading into next year, we're looking at planning our signature event still. We don't really know what that's going to look like. I'm sure every nonprofit can kind of echo that sentiment with me. But I'm confident that our community will rally together and come together, and like we have, and all of these nonprofits will hopefully survive and be strong in 2021. I kind of did a brief version of all of the things that I wanted to say, and a lot of stuff was already hit on. I guess that's what happens when you go last. So are there any questions or anything else that you wanted me to touch on, Rod?
No, but that's a great segue. I just want to quickly mention that the United Way Central Florida is partnering with GiveWell Community Foundation to do a Tri-County Needs Assessment. in the coming year, because we really don't know what services have gone away. We try to stay in touch with our traditional partners, but we don't know what services have gone away and what additional needs are out there. So that's one project that we're working on. And I also want to personally thank Publix and public supermarket charities just for all of the donations and assistance they've made to the feeding programs through Feeding Tampa Bay, the USDA, and the Farmers to Family Food Box, because they made a large impact throughout this entire crisis, through monetary and purchasing food for those programs.
Awesome. Well, thank you all so much. I know we're a couple minutes after 1 o'clock, but if anyone has any questions, feel free to unmute yourself and you can speak up if you have any questions.
I didn't see any in the chat room either, Catherine, just FYI.
Okay, it sounds like everyone's pretty quiet. So thank you all for joining us. And if you have any questions later, you know how to get in contact with us. And we will be announcing our next virtual Lunch and Learn soon. So stay tuned for emails and social media posts to come with more information. And also our signature brunch event will be happening in February. So more information will be announced very soon about that as well. Thank you all for joining us today. Bye.
Thank you, everybody.
Bye.
Thanks to the panelists too. Really
Thank
appreciate
you.
it.